So shall we go live and get set up?
Yes. Yes. I believe it's recording now from the message I just got.
Yes. So we are now live on LinkedIn, hopefully. And today, I'm delighted to be talking to NHS GP and lifestyle medicine Dr Manik Imsirovic.
Oh, well done.
I pronounced it right, yes.
You did really well.
We're going to be talking about
falls, and that has that knock-on effect of developing symptoms. Sorry, I've interrupted you there.
No. Sorry, I interrupted you. I'm not sure. Could you just explain FSH and LH? I'm not sure whether everybody will understand what they are.
Sure. So FSH stands for follicle stimulating hormone, and that's a hormone that's released to help the ovaries develop the eggs, and then it helps trigger ovulation.
Yeah. And
LH is something called luteinizing hormone, which helps with the development of the egg. But it's not just those hormones that are important. Estrogen is produced from this feedback system, and you also have progesterone, and women also have testosterone, but in a much smaller level.
Yeah.
And conversely, men also have estrogen, progesterone, and testosterone, but the amounts of those things are different, and men proportionately have more testosterone, and that's why they have other physical symptoms. But
absolutely.
as we age and the levels of these hormones fall, then we start leveling up. And that's why certain people may, for instance, women may start to notice hair growing on their chin or chest or other unwanted places. Men might be more aware of starting to develop breast tissue. So it's all about balance, really, of these hormones. And then you've got other hormones that modulate the secretions. So it's a very complex system.
Absolutely. I just think this media discussion is too simplistic, and it is a complex picture. I'm sure some people will be surprised to hear that men also produce estrogen and progesterone. I think most people probably are aware that women produce testosterone, but maybe they're not. I don't know. So that might be news.
Fine. I do think people need to understand more about their own bodies.
Yeah.
And one of the things that I find all the time is people just seem to think that this space is separate from the rest of it.
Yes.
Actually, that's not the way it works.
No.
And I do take your point, Helen, about the media touting HRT as a be-all and end-all, and woohoo, magically I'm going to be a new woman at the end of this, because it would be nice if that was true. And I have to say, I don't know anything legal that might make you feel radically different in a very short space of time.
No, absolutely not. No. I mean, and do you think the media discussion, I mean, it seems, we've said that it's simplistic, simplifying quite a complex issue, as in our bodies are complex. But it's, menopause is often billed as a hormone deficiency, which is kind of a negative view of it. I mean, I think that's too simplistic, but what do you think? Do you agree with that?
I think the biggest problem with the way the media have portrayed it is the impression that it's given women that they need to go and demand medication from their GP.
Yeah.
And I think I can understand why women may feel marginalized and misunderstood. And I certainly do think they need to be clear about what they want from their GP. But at the end of the day, we are there to help.
Yeah.
And we've always been there to help. And going in with a militant attitude makes it a very frustrating experience for both parties. And it's a shame because actually it's that therapeutic relationship can be incredibly positive. And I think more if people approach it as just getting information and trying out things and trying to see what possibly could suit them, but then having the discussion with the GP about what reasonable options are, because HRT is not a be-all and end-all, and it's certainly, there is some risk attached to it, and people need to be aware of that as well.
Absolutely. Could you say more about the risks? I think, obviously some women can't take HRT, such as myself, with a history of breast cancer. Some women don't want to. Other women prefer just to try anything natural. So could you say a bit more about the risks, to put them in context?
Yeah, I think generally it's thought if you're under the age of 60, risks, particularly of breast cancer, are considered to be low, much lower than was previously thought. And particularly if you are taking the topical medications, so we're talking about gels and patches rather than tablets, it's thought to be much, much safer than previously. I don't know if your viewers will remember, but certainly HRT has been going through swings and roundabouts, really, because the pendulum did swing quite far against HRT, probably more than 20 years ago. And there was a big scare amongst the medical profession about prescribing it. And then the pendulum's now swung back again. And in fact, actually, Helen, people who have had breast cancer can still get it, but I would stress that would be under the care of a specialized menopause doctor. And again, you'd need a very detailed consultation, because again, it's trying to weigh up risks and benefits and what risk is worth taking.
Absolutely. Yeah.
My understanding is if you're going on a very small dose of mainly topical estrogen gel or whatever, depending on the sort of cancer that you had in the past or whatever, there may be some doctors that are willing to take that on. But generally, I think most NHS GPs would be very, very cautious about that. And they may well want to get advice from a menopause specialist, oncologist, or whoever before they recommend that road to you. And if that was something that you were seriously considering, then I would say that would probably need a lot more detailed information. And I think you would have to ask your NHS GP what their thoughts on that were.
Okay. And when you started the answering the question about being under 60, risks are low, is that do you mean when women start to take HRT, and how long can they take it for, or is that is there an amount of time? Can they take it forever, or for years and years?
I think it's generally accepted that HRT is very, very helpful for a lot of women.
Yes.
But I would say it depends what form you're taking.
Okay.
So again, we usually try and do the lowest risk preparation. So that's why we usually start with gels or the patches. But it does depend on your own medical history, as you pointed out, personal preference, smoking status, lifestyle, and other things. So the risks, I think most people worry about breast cancer, but it is thought to be much lower risk if you compare it to people, say, that drink alcohol or who are carrying extra weight, having a raised BMI. So some figures to just bounce past you is that it's thought that there's 23 cases of breast cancer diagnosed in the UK population. That's per 1,000 women aged 50 to 59. And for women who are on combined HRT, so that's estrogen and progesterone, you get an additional 4 cases.
Okay.
Which is the same as women being on the contraceptive pill.
Okay.
If you are a woman who drinks 2 or more units of alcohol a day, that's actually an extra 5 cases, so slightly more risky than HRT.
Yeah.
If you are a smoker, that causes 3 additional cases.
Okay.
And this is just for breast cancer we're talking about.
Yes.
And for women who are carrying extra weight, so their BMI equal to or greater than 30, that causes an additional 24 cases of breast cancer.
That's a lot, isn't it?
It is, and I don't think people realise, and actually the state of knowledge has changed so much as well in the last sort of 10 to 15 years, that against all of that sort of background, HRT as well is considered fairly low risk. But I think it's important that women do their research about risks, because there's actually a lot of benefits to HRT as well.
Yeah. Do you want to talk more about the benefits then? Something a bit more positive.
Absolutely. So I just want to touch on the fact that a lot of women too, depending what studies you look at, a lot of their symptoms are underreported.
Okay.
So they just put up in silence.
Yeah.
With things. And I think one study was saying 50% of women that are aged between 45 and 55 have experienced menopause, but they haven't consulted their healthcare professional.
Sure. So, yeah, I've read that too.
Yeah, and you kind of wonder how many women are putting up with things.
Yeah.
And it has that bigger knock-on effect on relationships in the workplace. And I wonder if that's actually an underestimation, because that's only the women that owned up to it. There might be a lot of women that actually haven't actually talked about that at all.
Yeah, exactly. And then conversely, there may be women that have some symptoms that they think are menopause, but may not be. Maybe something else. Isn't that right?
Absolutely. Yeah, no, you make a really good point, because what I find is often women come to me and they just say, I've got this brain fog, I'm tired all the time. And I wonder if it's menopause. Now, I know one of the things I do, and I'm sure a lot of GPs do, is you do some basic blood testing.
Okay.
And what I'm looking for is whether there could be other causes for these symptoms. So when you come to a doctor with symptoms, we automatically start thinking, okay, what are the differential diagnoses for this? So could you
explain what that means, just for anybody that doesn't know, a differential diagnosis?
Sure. So if you come, say, with tiredness, what I will start asking, I might start shooting some more questions at you about how often is that happening? What makes it better? How long has it been going on for? And try to get a bit of background for. But for instance, if you are suffering from underactive thyroid, if you have low blood sugar, if you have anemia, these are all possible causes that contribute to a general tiredness, possibly a bit of thinking. And it's too easy to then default into that trap. Particularly if you're a woman in her 40s and upwards, you might start thinking, oh my goodness, it must be menopause.
Yeah.
You know, and I've certainly seen, I saw one lady not that long ago who came to me saying that her sister-in-law had said, oh, look, you're so irritable all the time. You know, have you thought about maybe you're going through menopause? And when I asked her things like, so are you having regular periods? She said, yes. And I said, are you getting hot flushes? She said, no. I was going, okay, so what makes you think this is menopause? And she said, well, my sister-in-law said it to me. And that sort of thing does make me concerned that people are defaulting too quickly to this, oh, I must be menopausal.
Yeah, absolutely.
And we need to sort of look after. I think this is menopause. And she said, well, my sister-in-law said it to me. And that sort of thing does make me concerned that people are defaulting to quickly to this, oh, I must be menopause.
Yeah, absolutely.
And when we're getting that echo there, isn't it?
Yeah, sorry, that's my fault. Sorry about that. Yeah, I'm still, I'm a novice at this LinkedIn Live technology, so apologies for that. I think I've sorted it. I was just trying to check for questions. Apologies.
No problem at all. So, yeah, that's why a lot of GPs will do some basic blood tests, like check your full blood count, your thyroid status, check your what's called an HbA1c to check your diabetes status, and very often want some background information, so like height, weight, blood pressure, family history, and medications, and all of that other sort of background information that's important.
Okay, and can you just talk about, because I think some women may be mistakenly thinking that, you can just test to see whether somebody's in menopause, so you can test your estrogen and progesterone levels, and obviously you can test them, but that it's not necessarily an accurate, doesn't give an accurate picture of necessarily where you are.
That's right, and particularly if you're on hormonal contraception, so the pill, there's no point testing it, because you're testing the artificial hormones that are coming from the pill, because that's estrogen and progesterone. So again, the clinical picture is important. So if you're over the age of 50 and you've stopped having periods for 12 months, there's no point doing the blood test, because you're already clinically in menopause. I guess the blood testing is possibly more important for ladies that are sort of 45 to 50, in that perimenopause.
Sure.
They may be starting to have some of the symptoms, say tiredness is a bit vague, but maybe the hot flushes. And they may be having irregular periods, but they're still having periods.
Yeah. Okay.
Yeah. So sometimes it is worth doing hormones in that sort of picture. Personally, I don't find it hugely useful, because the hormones rise and fall because it's a dynamic system. And if you're having irregular periods, I don't know where on the pathway you are. And I'm not sure it's going to make that much difference. So for me, it's not that useful. I think a lot of people want a black and white answer.
I think so.
Yeah. And I just look, with everything to do with the human body, there's very little that's black and white. There's so much gray in between, because all of us are different. We're all different heights, weights.
Yeah.
Everything's different. So
that's true. And also I think, certainly when I was younger, before I started studying, nutrition and biochemistry, the media talks about, an average menstrual cycle of being 28 days. And if you're not 28 days, you start thinking there's something wrong with you. Whereas that is just an average, so it could be from 22 to 35. I can't remember the exact figures, but so again, your cycling your hormones are going to be up and down over that cycle, which makes it even more difficult to pinpoint, if you take a blood test, a snapshot at one day, one time, where you are.
Exactly right. And you're right, it is a statistical average that people just did studies on, and drug companies needed some numbers to work with.
Yeah.
And again, it's nothing to get worried about if you find that your cycle is getting longer or shorter. But I think if you are worried, you need to have that discussion with a professional, because you can develop, say, things like fibroids or cysts or whatever.
Yeah.
And I think if you're worried enough to want to ask questions, then arm yourself with information. So have a look at what your cycle is. I think a lot of people use the apps now to track their cycles. If you are getting bleeding in between, arm yourself with information before you make contact with the GP, so that when you get into the GP, you can get the maximum out of the consultation because as everybody knows, you've only got 10 minutes in there, so you need to get in and get out pretty quickly and try and get the best out of the professional that you're seeing.
Yeah. So what else? So what's your specific advice then on getting the most out of a consultation if a woman wants to go to talk to their GP about menopause, about their symptoms, and they may or may not have in their head that they want a hormone prescription. But so what's your advice? What can they do to help you and themselves?
Yeah, so I would suggest it's very helpful to do their research, know their menstrual cycle, like actually make a note of the first date of their last period, how long it went on for, what it was like. No, it's helpful as well to give us some gynecological history. So how many times have you been pregnant? When did you first start having periods? What your general medical background is, and medications. And people always say, but isn't this in my notes? It is. But if you want us to spend a chunk of that 10 minutes scrolling through the notes, that means that things are going to be less satisfying for you. Yeah. It would be worth going onto the NHS websites, which has a lot of information about menopause and HRT options. And there's a really good website that's put out by the British Menopause Society. Has a lot of useful facts, figures, and some infographics that might be easier to understand. And Louise Newson is a GP who specialises a lot in menopause. She's done a lot of videos, and a lot of people find that very useful. And there are Facebook groups, Menopause Cafe and other things online. But again, I would suggest you are more in an information gathering mode and just be open to what other opinions are. But at the end of the day, it's just their opinion, and your situation may mean that you may not be suitable for certain things that other people have found helpful.
And how do you assess a woman's suitability for taking hormones, and what else do you advise?
Yeah, so usually I want to know their medical history, as we've talked about, and the gynecological history, and things like when was their last smear test, mammogram, smoking status, etc.
Yeah.
And it's very helpful to have a recent blood pressure measurement.
Yeah.
And so that's all part of the picture that helps you assess risk. But what's important to me is what the woman herself wants, what she's experiencing, and what she wants. Because if it's mainly, say, vaginal dryness, that means that she's feeling uncomfortable about having sex with her partner.
Yeah.
Then that's something she can actually perhaps address herself, not instead of waiting to see a GP, actually going along to the pharmacist and just say trying a water-based lubricant. Or now with the recent change in the rules, you can actually get estrogen-based creams available over the counter.
Yeah.
And so I think it's really helpful to any health professional if you actually try some things yourself.
Okay.
But if you're going to try it for a decent chunk of time, like we're talking like 2 or 3 months.
Okay. 2 to 3 months. Yeah.
Yeah. I mean,
not 2 to 3 days or 2 to 3 weeks.
Yes, exactly. It would be lovely if things work that quickly. And to be honest, placebo is a powerful thing. Some people do feel better just because they're doing something about it.
Yeah, yeah.
But I guess that it's important which symptoms are causing the most distress.
Yes.
So definitely things like hot flushes have a huge impact. And some people, and again, it's such an individual thing. I know when I asked my mother about her menopause, she said, like, oh, I had 4 children. I was working full time. I didn't even notice.
Lucky her.
And also, to be fair, the awareness then was very different. It was
Yeah.
not something that you talked about. You sort of had to just get on with it,
Yeah,
because
absolutely.
there was no options anyway.
Absolutely. I mean, I think it's good that, there is so much more discussion about it, so much more media awareness, like we were saying earlier, the Davina effect, and not just Davina, but many other women that are in the spotlight. But I do think it's a shame that it's not discussed more in the context of, a natural life stage. Rather than a medical illness, rather than a disease or a problem that needs to be fixed. And, what do you think about that? Do you agree?
I absolutely agree. But I think at the end of the day, women have to live their lives. And I have to say that I do find it's almost disrespectful to women to say, look, love, it's just down to your hormones.
Yeah.
I think women in middle life is becoming more backward facing. And what I mean by that is you start looking back on what you may or may not have achieved in terms of your job, your relationship, where you are. And I think it's the first time I realized I may have about 30 years of life left was kind of, wow.
Yeah, I know. Somebody said to me recently, because I turned 60, oh, you've probably got about 20 summers left. And that really is like, 20. Well, it sounds quite shocking, doesn't it? But I thought, well, yeah, I mean, if I live till I'm 80, which is, just below the average lifespan for women, then, yeah, maybe I have only got 20 summers left.
It's very confronting, isn't it?
Yeah, it is. It is.
Very confronting. And I think that's one of the things too that I say to people is that whatever you've been doing for the last 30 years has brought you to this point. And what we do now will influence the next 30 years.
Absolutely. That's what I'm talking about all the time, because, I know menopause can be quite difficult for many women. But it's not just, once the menopause, as we just said, once you've gone through the menopause and your body settles down, you could have another 20, 30 years of life. And you want that to be healthy, as happy as you can be, and active life, where you're doing things that you want to do. You're not declining into a decrepit state, for want of a better description.
Yes, you want to be living, not just alive, isn't it? You want to have a good quality of life. Yeah, and I think everybody dreads being a burden on their friends and family. Nobody wants to be, I don't think anyone wants to be alive under those terms. So
no, definitely not. Definitely not.
Yeah, and that's why we keep coming back to the lifestyle stuff. And HRT is one of many options, but you have to do the other stuff, like look at what you're eating, keep moving, keep strong, keep your relationships going, reduce the toxins. All of that stuff is really, really important. So you have a good quality of life for whatever time remains.
Yeah, absolutely. Yeah. So just going back to HRT, I did have a few questions put to me. One was about testosterone. So there's been some more, I think Davina's covered this, how testosterone was game-changing for her. And, so what's your views on that? Can it make a difference? Is it available? I don't think it's licensed, is it, for use for women in the UK? No.
I know that a lot of private providers prescribe it, but your average NHS GP won't be able to. It depends where they are based, but I think certainly for my practices locally, it's not on the formulary, so we're not allowed to prescribe it anyway.
No.
But yeah, some of the private prescribers do. I think that one of the tricky things is that if you do go private and then you want to bring that prescription back into the NHS, you'll start bumping up against local protocols because, there are restrictions around what an NHS GP can or cannot prescribe.
Sure. And can you talk about what or how testosterone can help? And what symptoms
Yes,
and what circumstances,
yes, sure.
as
Well,
to your knowledge?
So testosterone is usually prescribed because it's thought to be helpful with libido.
Okay.
And generally over time, as the hormonal levels are falling, if the estrogen and progesterone, that's also happening with the testosterone.
Mm.
But the thing is, a lot of the women don't necessarily complain a lot about low libido. It might be more their partners complaining about low libido. The way I look at it is, if it's not causing the two of you a big problem, that's fine.
Mm.
But if it is causing, if it's causing the two of you a problem, that's a different kettle of fish. And I do think perhaps the relationship also may deserve further time and perhaps a period of reassessment, because like we said, your relationships change as you're aging. And if your children have left home and you're actually facing each other again after a long period of always putting other people first, it may be that is also what needs time and reassessment. And no amount of creams and things is necessarily going to fix that if you actually don't like each other very much. And
no, very good point. Very good point.
But yeah, so the testosterone, the supplementation is usually offered as a type of gel, but it's not usual to be doing the blood testing for that. The blood testing as well, you'll find the levels rise at a certain time of the day. So you need to be doing it at between, I think, 9 and 11 o'clock in the morning. Okay. But it's difficult to know because it's not really something that's offered on the NHS as such. But as I said, private prescribers may be able to do that for you. But yeah, the cost of that and how long you can actually do that for is another debatable point, really.
Okay. And going back to HRT itself, one thing I wanted to ask you was if you could just explain body identical versus bioidentical and what you in the NHS prescribe.
Yeah, so those terms sound very similar.
They do. That's the confusing thing. Yeah.
Yeah, and I think a lot of people are very, very confused by it. So body identical is what's prescribed in the NHS. So, yeah, and the reason we're not so keen on the bioidentical stuff, or sometimes it's called compounded preparations. And the thing is, because it's compounded, it's been put together by a pharmacy or other company, and it hasn't been subjected to rigorous clinical trials in the way the HRT has. So some people do find they get some relief, but because there's no scrutiny around it, the long-term safety of those products is unknown.
Okay.
Yeah, so that's but yeah, if you go to an NHS GP, generally you'll be given body identical. Okay. It's usually plant-based, actually. It used to be pregnant mare's urine.
I know, that sounds horrific, doesn't it?
It does, but when you think about it, yeah, you've got to get the hormone from somewhere.
Yeah.
And nowadays it's plant-based, so they get it from yams and things, which is why maybe as a nutritionist, Helen, is that something you ask your patients to do?
What? Sorry, eat yams?
Yeah, to eat yams and other phytoestrogens and things to try and
absolutely.
boost.
Yeah, I mean, I depending on symptoms, I always recommend phytoestrogens, and I prefer to have, them taken in as food rather than supplements, although there are many supplements out there with lots of different phytoestrogens in them, and which means, to explain what they means the phyto just means plant, estrogen. So there's many plant foods out there like yams and soy and flax seeds that mimic human estrogen very, very weakly. So obviously they're not as strong as human estrogen, but they can have powerful effects on the body and on your estrogen levels, and can be really helpful with symptoms. So it just goes to show, if the medication is produced from plants, then how powerful they can be.
Absolutely. And I think a lot of people find that actually very helpful, isn't it? With sort of hot flushes and those sort of symptoms, the vasomotor symptoms. To be
honest, there's a lot of things that impact hot flushes, diet, lifestyle, too many sugar, starches, stress, alcohol, lack of sleep. They can all impact hot flushes. Okay. Something that we haven't talked about is the common side effects. So we've talked about the risks, the health risks and people worrying about breast cancer and other things. But what about the most common side effects? Can we talk a bit about that? Of HRT?
Yeah. No. I was just going to say the side effects does depend on the formulation. So whether we're talking gels and patches or tablets, as you can imagine, anything you put in your mouth is going to have more of a knock-on effect. A lot of the side effects are thought to be due to the estrogen more than the progesterone part. And that's why we usually tell people you're going to need a few weeks, at least 8-12 weeks or so to let things settle down. But as you can imagine, your body was winding down on the hormones and then you're giving it more. So you may find that you do get sore breasts. You might get headache or sort of menstrual type of symptoms almost, where you get the bloating and the muscle aches and pains. Some people get a bit of acne and they notice some changes in their skin. And it depends on the formulation that you're using as well, whether you're using continuous with no breaks or whether you are using the sort of formulation where you do get breaks and you actually get a withdrawal bleed. So that will depend whether you've got a uterus or not and the other medical history that you have.
Yeah, of course. And where you are, how old you are as well. So
absolutely. And your weight and all those other things that can influence it. But it's not uncommon to have a bit of irregular bleeding in those first few months.
Okay.
But if you've been stable on HRT for a while and then you do develop bleeding, that does need to be looked into more closely.
Yeah, absolutely, definitely. And is weight gain a common symptom? I've seen that asked quite a lot in forums.
Yeah, I think so I think it's thought to be more of a problem with the oral form of it.
Okay.
And if you're having continuous HRT, I always find this one a bit of a difficult one because there is an element, I guess, of bloating and fluid retention. But I think, again, if we're assuming everything else is unchanged, so you've got a normal thyroid, etc. It's a bit debatable. I mean, the drug companies will have you believe that actually it's not due to the medication. But certainly some women do report that they find that. And I would encourage you then, if you are finding that it's helping your symptoms, it might be worth looking at, perhaps we should be looking at the dosage, or would you be happy to maybe doing more weight-bearing exercise and trying to balance out what is the lesser of the two evils. So if you're happy with the other effects that you're getting from the HRT, then you may be willing to put up with that. But I would encourage you to be exercising and doing those other things anyway, because we want to be, like we said, strong and independent physically for as long as possible.
Absolutely.
So it's thought to be mostly water retention in terms of the weight gain.
Okay.
I guess there's some of the concern about whether you're tending to retain fat and whether the fat is around your waist, because the concern is around belly fat.
Yeah.
And because that has certain risks about cardiovascular effects, etc. But yeah, sometimes women, if you've tried it for several months and you're really not happy with it, it would be worth trying maybe a different preparation, because there are so many out there.
Yes.
It can be worth changing it, because it could be that it's one of the particular constituents that's causing that. But yeah, it's definitely worth having a chat with your provider. And sometimes think other side effects like nausea.
Okay.
Some women find that if they're just taking their HRT tablets at night instead of in the morning, or taking it with some food, that helps. Or sometimes if you change to a gel or a patch, because you're not actually taking a tablet. I find a lot of people get nausea if they're taking any sort of tablet on an empty stomach.
Yeah.
So
yeah,
it's not, it could be just that sort of picture rather than something due to the medication itself.
Okay, brilliant. Thank you. Right, well, I think I've come to the end of my questions. Is there anything else you'd like to add or say?
Yeah, I mean, I would like to just talk a little bit about lifestyle medicine.
Yes,
because
yes, of course.
Yeah, because I do believe that is something that will save the NHS.
Yeah.
And it is incredibly powerful, because it's something that we can do for ourselves. Now, I know people often say, why are doctors so useless about prescribing, and they don't have enough time and all of that sort of thing. And the problem is that when we're taught on what's called a sick model of medicine. So what that means is that somebody comes with a symptom or several symptoms. We then work out possible causes. We conduct tests and we examine you. And then very often may talk about prescribing something.
Yeah.
And this is one of the things that I actually hate, because I think if you don't address the underlying causes, you start this slippery slope of more and more medication.
Yeah.
And in my book, and I know this sounds weird coming from a doctor, but medication doesn't cure you. Medication is a means to an end. But if you don't address the underlying causes, and certainly in lifestyle medicine, we talk about 6 pillars. So diet, exercise, sleep, stress, toxins, and relationships, which you touched on earlier.
Yeah, yeah.
And if one of those things is out of whack, then the overall balance is going to be difficult. And if you want long-lasting change without loads and loads of medication, then looking at the lifestyle medicine or those lifestyle pillars is very, very helpful.
Yeah, absolutely. Totally agree with you. Obviously, I'm in the nutrition and lifestyle medicine business, so obviously I would say that, wouldn't I? But it is good to hear that coming from you too, because HRT aside, you know, what you see in the older population is, you know, the multiple meds, polypharmacy, you know, they're taking a medication for this, and then they take another medication for the side effect of that, and another medication for the side effects of that medication. And before you know it, you know, I've seen some of my clients that I've seen, you know, are on 4, 5, 6, 7, 8 different prescription meds.
And it's miserable, isn't it? No wonder they feel sick. They can't open their bowels and they just have no energy at all. It's just ghastly, you know?
I know.
And I just want to remind people that actually your body's really good at fixing itself.
Yeah, if you let it.
Exactly. And if you can support it to actually do that.
Yeah.
And if people are interested in lifestyle medicine, I ask them to just have a little look on YouTube. There's a Dr. Dean Ornish.
Oh, yes.
ORNISH. He's one of the gurus and the leaders in lifestyle medicine in the US. He does a brilliant talk called Healing Through Diet. And he just shows how you can unblock the major arteries in your heart, switch off the genes that are involved with cancer by addressing those lifestyle pillars.
Yeah,
and
absolutely.
It's a message of hope, because
it is, and also it's because it's not talked about in the sort of wider public domain. I think generally the general public just don't appreciate how powerful they are. You know, when I'm talking about the power of nutrition for solving menopause symptoms, I know a lot of people don't actually believe me. They don't think it's possible until they try it, of course. But yeah, that's kind of sad, really. But that's a lack of education and awareness. And also, you know, I don't want to sound too cynical or end on too cynical a note, but nobody is making lots of money out of somebody eating more greens. So,
and actually, that's a really good point, Helen. That's something that I do talk about, is that in the US, the sick model of medicine is being reinforced all the time because the drug companies make a lot of money out of it. So they're not interested in making people well by reversing their diets and lifestyle. But in the UK, thank God for the NHS, it's all about cost.
Yeah.
And the NHS don't want people on loads of medication because it costs too much money. But if people are able to look after themselves and change their lifestyle, then they won't need the NHS very much, and they won't need loads of medications. So again,
well, no, that's true, but there isn't really a focus on prevention, though, is there? There still seems to be a focus in the NHS of prescribing.
I think the NHS is trying very hard to roll that out, because they do have central prescribers. They're encouraging people all the time, and people that are pre-diabetic or diabetic are also being targeted and offered a lot of diet and advice stuff. But the thing is, you can always offer people things, but until they appreciate the importance of them making their own effort to manage their own health.
Yeah, taking responsibility.
That's right. And it becomes a bit of a heated topic sometimes.
Yeah.
And like you say, Helen, I think people just need to be encouraged and supported, hopefully get the information that they need, and then they can continue to make changes that will be long lasting, and then they'll have the quality of life that they want.
Absolutely. Well, I think that's a good place to end it. How can people contact you if they want to? I mean, do you see people privately? You maybe...
I do, yeah, I do. So I still do work in the NHS.
Yes, I know. But just in case anybody wanted to contact you, how do they find you?
Yes, I have a company called Medicine and More. They have a website that's currently undergoing a bit of a revamp.
Yeah.
But they certainly can drop me a message or through LinkedIn or however they want to approach me. Okay. I'm very happy to have a chat. And really it's to find out what suits them and whether we can get together and make some changes that will give them long-lasting health, because at the end of the day, that's what I want for people.
Absolutely.
And I hope that they can see that I do and try to practice what I preach. And of course, if they need more detailed nutrition advice, then I do refer to experts like yourself.
Absolutely. Thank you. Well, I'd just like to thank you for your time. Thank you for a wonderful conversation. I hope that anybody watching has found it useful and informative. And if there are any questions, any comments, you'll be able to this conversation will be visible on LinkedIn, and I think we'll both have access to that. So I'm going to stop the recording.